Good afternoon, everyone, and welcome to another Grace Presents webinar. My name is Haley, and I'm the Content Marketing Manager here at Grace Management. For those of you who don't know Grace, we are a senior living operator and owner of active adult, independent living, assisted living, and memory care communities across the country. Thank you so much for taking the time to join us today. We are so excited to have our friends here with us today at My Senior Health Plan to join us for our webinar, Understanding Medicare, Your Guide to Making Informed Decisions. Whether you are preparing to enroll Medicare yourself, reviewing your current coverage, or helping a loved one navigate their options, we hope you can walk away with a better understanding of Medicare and the confidence to make informed decisions. Before we get started, we'd love to know a little bit about who's joining us today. So we're going to launch a quick poll. If you could please take a moment. Let me just launch that poll for everyone. So are you someone that has an aging parent, a caregiver to a spouse or a loved one? Do you work with older adults, or maybe you are somewhere in the other category? If everyone could just take a moment and answer that poll. We have a little bit of a split with who's joining us today. So we have some people that work with older adults and also people that have aging parents. We're still getting a couple answers come in, so I will just give everyone a minute to take that. Awesome. Mostly people that work with older adults and have aging parents. Then we had a couple of others as well, so I'm very curious on who else is joining us today. We also want today's webinar to be as helpful and interactive as possible, so we encourage you to submit questions throughout the presentation using the Q&A feature. If we are unable to get to your question live, we will be sure to follow up with you via email after the webinar. I'd like to begin by introducing our speakers today. We will hear from Pete Blassie, CEO and President of My Senior Health Plan. Pete, if you would like to take a moment to tell us a little bit about yourself and discuss your background.
Thank you, Haley. I'm so happy to be here. And I want to say thank you for everybody for attending. My name is Pete Blassie. I'm President and CEO of My Senior Health Plan. For the past 21 years, we've been helping the senior community with Medicare, insurance, and beyond. Um, we started it 21 years ago. We've seen a need in the community for transparency and advocacy, and we aim to assist. And it's a passion of ours. And everybody that's you know is on the team. It's a passion of theirs. Everyone's very hand selected. Today, we also have Nicole Medina, our marketing manager. It's very involved in all aspects of My Senior Health Plan and really engaging our community, making sure that they know that we're out there. We do a number of things just to engage the Medicare community, make sure they're well informed and supported with their Medicare choices.
Thank you, Pete. And also, if you don't mind me asking, what made you go into Medicare and open this organization?
Yes, shortly after graduating from business school, went into financial planning, but I always gravitated to seniors. And my mother worked in hospice, and there was always an advocacy wrapped around seniors. So, with that, I seen a real need for transparency. These plans change, people's needs change. They call one plan and they're getting sold. And I go, they really should have one place, one-stop shop that the brokerage is in their corner. And there really wasn't a brokerage wrapped around Medicare when I first started. It was an idea. So since then, things have really evolved, and the internet was really evolved, and we really became that one-stop shop. We're licensed nationwide. We have access to almost all carriers nationwide to really not only walk them through their plans and then support them year over year with those plans.
Awesome. And then next, I would like to introduce Nicole Medina, Senior Digital Marketing and Events Manager at My Senior Health Plan. Nicole, if you also just want to take a second to discuss your background.
Yes, hi everyone. Welcome. Thank you for having us. We're excited to be here to just delve into Medicare. But my background comes with a plethora of marketing, sales, but also coaching. And coaching is what really is a passion of mine, and just caring for individuals. And I'm located in the La Jolla area in California.
Awesome. And if you don't mind me asking, what kind of drew you to this industry?
Yeah, absolutely. Great question. My mother helped caretake my grandmother, and I saw firsthand all of the challenges that came along with that. And then my mom herself and father went through Medicare. And so firsthand, I got to see that it was an area that needed special attention and help. And I just love my family and I love my parents. And I knew more people in my family and neighborhood would start aging. And that's how I broke into this.
It's always so important when there's a personal perspective to a career and everything.
Yes.
So today we'll be covering all things Medicare, including what it is, eligibility, administration, the costs associated with it, what it covers, what it doesn't cover, bridging the gaps in insurance, and enrollment. Medicare can be a confusing topic, and the good news is that you don't have to navigate it alone. And that is exactly why we're here today. So, with that, I will turn it over to Pete and Nicole to simplify Medicare and walk us through what you need to know.
Thank you, Haley. Well, this slide tells it all. You turn 65 and there's just so many questions, where can I get help? Why can't Social Security give me everything I need? There's all these questions that come to mind because it's a big step. You're moving from your employer group sponsored program many times or moving into a new county or state and you have Medicare and there's like, where do I go for all this? So it could be confusing and we understand and we really try to make it simple. So that's why we created a system where we really ask about what's important to you and what's going on in your life and break down Medicare just in pieces to make sure it's digestible and easy to understand.
Awesome. I imagine everyone watching today could probably point to at least one of these questions and say, that's exactly what I've been wondering.
So a little bit of history about Medicare. It started in 1965 by Lady Truman, and they've seen a need in our population as we get older. We need some type of insurance that's going to be there for them. So there's 19 million people in year one of enrollments. That's huge. Now we are 66 million in 2023 Americans enrolled in Medicare. So that's a lot to administer, I mean, by the United States government. And, a lot of times Medicare is considered the holy grail of insurance. You want to get there because you're going to have probably better coverage than your group sponsored program, under 65 program. So in 1972, Medicare expanded to include people with disabilities. So we'll talk about that. 1999, Medicare Part C, January became effective. So that's amazing. And I believe President Bush superfunded it around that time that it really allowed a lot of extra benefits into the program that original Medicare really didn't include. So now it has groceries and Uber and all kinds of great stuff.
It's fascinating to see how Medicare has evolved over the years.
Yes. Yeah. And then the last piece there just was in 2006, the prescription drug program. And it's kind of hard to believe that there wasn't a prescription drug program, when it started, but it's very important. And that's included in a Medicare Advantage program or Part D. But yeah, lots of fun facts there. I remember when it came out.
And then we do have another poll question. So, oh, sorry, I'm getting a little ahead of myself on the polls.
All right. So talking about the Medicare eligibility. So this is always fun. So when you turn 65, you're a med you're and worked in the United States for for generally 5 years, you are eligible for Medicare. So people that are under 65 with certain disabilities, like if you're disabled for 2 years, you're eligible for Medicare. And anyone with ESRD or ALS is eligible for Medicare immediately. So there's Medicare Part A, it's for hospitalization, Part B for medical. So very important. This is called Original Medicare.
Now we are ready for our first poll. So what is your current relationship with Medicare? Are you turning 65 and enrolling Medicare for the first time? A caregiver managing a senior's health benefits, currently enrolled in Medicare, or have a disability that qualifies for Medicare and want to learn more? So we have a kind of a split today. We have a lot of people turning 65 and enrolling for the first time, or a
Wow,
caregiver currently managing a senior's benefits.
great to know. Great to know. So Original Medicare, administered by the government. We talked about parts A and B. And then we have parts C and D, and these are generally through insurance organizations. So part C, otherwise you probably heard in the market, Medicare Advantage program, MAPD, prescription drug is the acronym, or part D there is prescriptions. And there's also something called a Medicare supplement, which is a little piece of insurance that picks up where Medicare leaves off.
And Pete, why is it so important to understand original Medicare before kind of exploring additional coverage options?
Yeah, so it's very important. Roughly, original Medicare covers you 80% of the cost of Medicare. So you have this exposure of other 20% plus, deductibles, unlimited, the exposure. So it's very important to curb that exposure either through a Medicare supplement or a Medicare Advantage program. So, it's definitely something to look at. Generally, we don't see anybody that just stays with original Medicare and leaves himself open to that exposure.
Sure.
So understanding the cost of Medicare, yes. So Medicare Part A, generally that comes as you earn it. And then in Part B, differs from year to year. So, and depending on how much you earned over your lifespan, especially in the last 2 years, they take that in consideration to to consider what's your Part B premium. So a little bit about Part A. When we're talking about Part A, we're talking about hospitalization in uh, in service to hospitalization at the hospital, care on special hospital units. We're talking in drugs that are administered at the hospital. This is very important, not drugs that are picked up by Part D. Care management as well, and that control pain to the terminally ill, like in hospice and things like this. Lab tests, X-rays, radiation treatment. This is all Part A in uh, in hospitalization. Yeah.
Makes sense.
Yep. So what's covered by Part B? This premium that you have to that you have to pay with Part B. So this is your annual physical examination, preventive care such as flu and pneumonia shots, emergency room services, blood tests, diagnostic, outpatient mental health, things like this. And, outpatient X-rays, MRIs, which can be confusing. What's inpatient and outpatient? If you were checked into hospital, it's going to be covered through Part A. If you're not, generally, it covers under Part B, the X-rays, MRIs, and things like this. Durable medical equipment for home use, oxygen, walkers, things like that. Yes.
Awesome.
What's not covered by the original Medicare, this is really important. A lot of people, think it's covered, maybe not. Routine eye care, hearing tests, for example, most dental care, routine foot care, foreign travel. There's a number of other things that are not covered by original Medicare. These are I would say, the top things that kind of keep on coming up. Uh, with that robust dental care, things like that is not covered by original Medicare.
I think this is probably one of those slides that might surprise a lot of people to kind of realize exactly what isn't covered by original Medicare.
That's right.
And just while, everyone's watching this today, I just want them to continue to think back about like kind of where they are in their Medicare journey, and kind of what they're looking for to get out of this presentation today.
Bringing the gaps in coverage, bridging the gaps in coverage. So we're going to talk a little about your options. You have options when you turn 65, when you're Medicare eligible, and you'll keep on having options as well, because there's different things that trigger events in your life. You might move to a new county, that triggers an event. You may be coming off a group sponsored program, that triggers an event, or be eligible for Medicaid, that triggers an event. There's lots of events that happen even when you're 65 and over. Medicare supplement plans. So Medicare supplement plans. Now, this is that little bit of insurance that picks up where Medicare leaves off. So not to be confused with an Advantage plan. So these are not administered by the government. These are by individual insurance organizations. It could be used anywhere in the United States as long as they accept Medicare. It's guaranteed issue when you turn 65, right? But if you're 65 and over and you missed a window, you may be subject to underwriting. There's some other nuances in there if you're moving or if you're coming off a group program that it could be still guaranteed issue, but that's something that we could assist you with. Help that covers the sneaky 20% from original Medicare doesn't pay. That's correct. So this where again it picks up where original Medicare leaves off. So it does not include the Part D coverage. That's a different piece of insurance that we would want to introduce to pick up those prescription drugs and avoid that penalty from the government.
Yeah, there's just one thing that's important to note here, and Pete can talk a little bit more on that, is that sneaky 20%, there's no stop loss on that, right? So it's continuous. Anytime that there's something that comes up, it will be continued.
Yeah. And the premiums, it's really, you hear about like Plan G, there's these letters of these different plans that cover that other 20%, a little bit differently. And our Medicare specialist will go over those with you. But the premium, there's a range of how much it might cost in your area. When you turn 65, we see it between $150 to $200 a month when you first turn 65 for, let's say, a Plan G.
Yes, and this is a great plan also if somebody is traveling quite a bit. Maybe they frequent another state quite a bit, maybe they're going across the US, and it's not an HMO or PPO, and that's where people get confused.
Yeah, people refer to them a lot of times as PPOs, but it's really not, because the PPO still has a network where that you have to see that's in network and out of network. This is a Medicare supplement is every physician that is contracted with Medicare. Every physician that's contracted with Medicare. So there's not a network. It's every physician's contracted with Medicare will accept a Medicare supplement plan.
Oh, that's interesting.
Yeah. The Part D. So we talked about that it came out in 2006 and it's administered by private insurance companies. And there's a Plan D model as well, the original Plan D, but each company can enhance that model. So that's why it's important to review your Plan D from one company to another. They're typically paired with supplements. Each drug plan is unique with its own formulary and restrictions. Again, there's an original model, but each company can have formulary restrictions. So it's important to review which plan D is most appropriate for you.
And where like prescription medications are one of those areas where everyone's situation is unique. So is it something that like it can kind of be tailored to them, like where you're talking about not every company has the same.
Absolutely. So a proper agent will ask you about your prescriptions and review the different plans that has that accepts those prescriptions and find the plan that's most appropriate and present that to the Medicare beneficiary.
That makes a lot of sense.
Mm.
Thank you.
Yeah. Medicare Part C. You might probably hear a lot about this on the news, on commercials, all these different plans that are out there that are Medicare Advantage programs, and they include a lot of different things today than when they first started. So they're administered by private insurance companies. It combines Medicare Part A and B. You need Part A and B, and some will offer the Part D as well. That's MAPD. There are some that are MA only. They're more geared towards our veterans. So they come in different flavors like HMOs and PPOs and even POSs, but most are moving towards the HMO model. It helps cover those costs, including deductibles. It limits the deductibles and co-pays and co-insurance has to do with original Medicare. So you have this all-encompassing plan, and the premiums tend to be from $0 to $100, but there's a lot of zeros out there in different counties. And I think it's important to note each county is different. So you could be living in one county and that same plan may not be, you know, you know, available in another county. So I think that's very important to note. So each county is different. So if you're moving out of one county and going into another county, you really want to review the plans in that county because you'll be disenrolled from your previous county if you move and don't engage your broker. Yeah.
Yeah, because a lot of these plans and carriers, they're nationwide. And I think there's an assumption that people think that, oh, it's a national carrier. I can just carry that over with me. It's going to follow me. But there's so many parts to that. And that's why it would be good and advantageous for somebody to reach out to us and understand that.
Yes, you definitely want to review it before you move to a new county because if you could land on your new plan and it'll be all nice and packaged for you when you go into your new home. But if you don't do anything, you'll be disenrolled from your plan generally within 2 months of landing in your new county. So it's very important to review those plans when you move into that new county. So and we're here for you. It's a free service to make sure. I'm not sure if I said that yet, but our service comes at no charge. And most of these plans, as you can see, they're many start at zero, not in the area.
Yeah, it's like I feel like a lot of people probably assume that state to state it's different, but to think even county to county, you might even just move down the road, but your city changed and your county changed, and now there's this whole other thing that you have to worry about when you're moving. So that's definitely something that I think a lot of people don't know. And from my knowledge and your mention of like commercials and everything that have really kind of popularized Medicare Advantage plans, it's still important, and correct me if I'm wrong, Pete, but it's still important that they really understand how they work together, whether they're the right fit for each person's individual needs.
Absolutely, because there's not one plan that fits everybody. Everybody has different needs, different positions, different prescriptions. So we always say it could be great for your neighbor, could be almost
Mhm.
disastrous for you, and it could be great for them. But everybody has their own preferences, and that's the advantage of working with my senior health plan. We'll take all their preferences down and make sure that we find the right plan for them.
And I think even to the point of where you say, your neighbor's plan that might not be right for you, I feel like there's something that really goes on when people don't understand things. It's like, well, what do you have? What do you do? And then just copying and pasting essentially what somebody else that, might have the Medicare coverage already. They're already 65. This person's, turning 65 this year. Oh, I'm just going to sign up for everything you signed up for. But that it's not a one size fits all.
Yeah,
Yes.
we definitely don't want
Cookie
to do
Yeah.
cutter.
that.
Yes, it's not cookie cutter for sure.
That's right. That's right. So potential benefits on a Medicare Advantage program. I'm really excited about this slide. So, these Advantage programs have really built up a lot of additional benefits through the years to attract people into these programs. They are network based, but if you work within their network, there's a lot to gain that original Medicare doesn't pick up. So, hearing tests and hearing aids, eye care and eyewear, the glasses even, dental care, routine foot care, foreign travel coverage, very important. So, if you're traveling abroad, it does cover you outside of the country. Each plan has its own little nuances. So, if that's important to you, make sure your agent explains that for that particular plan that he or she is presenting. Transportation. When we talk about transportation, we're talking about non-emergency transportation and emergency transportation. We have the emergency transportation is covered, but non-emergency transportation. And many of these plans are even offering Uber for seniors. So it's they're really moving along with this non-emergency transportation. Gym benefits. There's some incredible gym benefits that are embedded into the program that we've seen over the years have been really built up. And over-the-counter benefits. So what does that mean? Like some plans even have a grocery card that they have these over-the-counter benefits that are extended to that. No alcohol or anything like that involved, but they do have this over-the-counter benefit for groceries. Chiropractic care. So we've seen chiropractic care, acupuncture, for example, as well embedded for some of this in some of the plans. So there's even a holistic type of approach in some of these plans as they enter the market.
Some of them even have podiatry as well.
Podiatry, you said. Yeah.
Mhm.
Yeah,
Yeah, it
absolutely.
seems like this plan kind of covers a lot of where original Medicare might lack, plus some.
Yes. So a little extra protection goes a long way. So there's these a type of insurance called hospital indemnity. So depending on your area and what's offered, hospital indemnity is a type of kind of a little a little supplement or a insurance that can pair with a Medicare Advantage program. So going back a little bit, these Medicare Advantage programs still have co-payments that are involved. Most don't have a deductible, but some of them might have to have a little bit of co-payment for your doctor visit. Hospitalization, let's say it's $300 for the first 5 days. So to augment that, and some people could pick up a hospital indemnity program that may reduce the financial stress of these co-payments. So we do offer that as well. And you can talk about hospital indemnity at the same time with the agent while you're talking about these Medicare Advantage programs. So ask your agent or my senior health plan agent about the hospital indemnity programs. Many times you're only guaranteed into it when you're 65. So you don't want to miss that window.
And for those listening that may not know what hospital indemnity is, can you just define that really quick?
Yes, it's a type of insurance that reimburses you for different types of activities or
Hospitalizations. Yeah.
hospitalizations that you might have or doctor's visits that you might incur through a Medicare Advantage program.
Awesome. Thank you.
Yeah, it really just helps pick up where Medicare doesn't cover because we can't make the assumption that it's going to cover everything. It covers a lot, but then hospitalizations can add up over time. as
Mhm.
well as where it could pick up, which is really fantastic. Part is that you may need help with somebody coming in to watch your pet. You may need help with laundry. So it's going to pay you out a cash benefit directly to you that you can use any which way you
Mhm.
want.
And really think of it as your like third base. So you have original Medicare, you have a Medicare Advantage program. Within the Medicare Advantage program, you might have some co-payments in there. This hospital indemnity picks up those little co-payments. It's a small piece of insurance. So it's like third base uh, of insurance.
Makes sense.
Hmm. So Medicare varies by state and county. We talked a little bit about that already, but they're very county specific to the plan options and benefits and pricing, the availability of the services, and the hospital groups and networks. So that's why moving into a new county, you want to speak with an organization like ours that helps you pick a physician or a plan in that new county. So when you land in that new address and that your new home, that everything is lined up, it and you have your new plans could be starting. Generally, it's always on the first of the month. So even with the supplement program, it differs even by zip code. So, as you move through the United States, definitely you want to engage in your agent in asking about, what plans are available in that area.
Yeah, and the great thing here is that how our service works is that we're tuned in to all these different medical groups. We understand what's happening in counties and different cities across the United States. So we can really, truly match you up with medical groups and doctors that are going to match your specific needs or ailments, concerns, and lifestyles as well.
Yeah.
Awesome.
Yep. Medicare enrollment, when and how to sign up. Yes, very important. So,
Really quick, Pete, before you move on, because we just got a question.
mhm.
So I just want to move back really quick. So I just moved my mom into a senior living community in my town, and I'm not sure what to do about her Medicare coverage or finding her new providers. Where do I start?
Yeah, and that's a great question for my senior health plan agent. You'd call and we could present all the different plans in the area, right? There's going to be questions like what hospital she prefers and or what position that she prefers, and making sure it all lines up. It's really interesting. If you call the company directly, these are the same plans, but they generally try to sell you on the plan that they represent. So, and a lot of times the seniors could land into a plan that they don't have their doctor or the hospital they want because they're trying to sell that one plan. We're agnostic. We're in your corner. We want to make sure that it lines up with your life, and that's the advantage of working with us. And there's no fee to working with us. It's the same exact plans. We're just in your court, making sure that everything lines up. Sometimes we even say, hey, you're on the correct plan, a lot of times, and say, don't move unless something else, it moves in your life, or you stay where you're at. And we get a lot of referrals for doing that. So we're very proud of that.
Awesome. Thank you for answering that. So now back to Medicare enrollment.
So, okay, original Medicare, and these are the enrollment periods. The IEP is the initial enrollment period. This is the 7-month window when you have the chance to pick a plan. So it starts 3 months before you turn 65, the month of, and 3 months after. In this window, you could pick a Medicare supplement, and be guaranteed issue into it. You could pick a Medicare Advantage program anytime in the year. This revolves around your birthday when you're turning 65. The general enrollment period is for original Medicare is this January through the 31st. If you miss your IEP and you don't qualify, yeah, this is time where you could jump in and ask. and jump into that original Medicare. And then there's a special enrollment period for losing employer coverage or other life events that may trigger this type of special enrollment period. A lot of times it's employee coverage that you may be ending and going into original Medicare.
Okay. Would another maybe be your spouse was your provider for health insurance and then they pass? Is that also a special?
Yes, well said. Yes. Well said, Haley. Yes. So if you're, for example, you're like, well, I didn't work, I was home, my my husband, it turned 65 and now I'm 65 as well, you automatically get Medicare through your husband's credits. So yes, and that'd be a special election as well. Yeah. So enrollment periods for secondary insurance, this is what you hear about, the annual enrollment period's coming and you have choices and such. So starting from the IEP initial enrollment period, this is the 7 months. We talked about 3 months prior, the month of, and 3 months out. Now, just going back for a second, original Medicare we talked about on the earlier enrollment periods, this is the secondary insurance. So there's also an IEP there, not to confuse you. AEP, annual enrollment period, runs from October 15th through December 7th. This is a time where you could change your Medicare Advantage program or your prescription drug program. So you'll see a lot of commercials come out and saying, we have a new plan in your area, evaluate that plan. It has these types of benefits. You want to make sure these plans are always working for you. This is the time to reevaluate your plan and make the change. October 15th through December 7th. If you miss that, for Medicare Advantage programs only, not for the prescription drug programs, January 1st through March 31st, you could switch back to original Medicare and just get off the whole Medicare Advantage program, or switch to another Medicare Advantage program one time. So that's through the open enrollment period. So then we go into April, into the October 14th, is the special election period. So this is the time period where, new movers, someone coming off a group program, if you qualify for Medicaid, these are all special elections, and which is generally done during the special election period. And then lastly is the guaranteed issue period for Medicare supplements only, which is 6 months prior to you turn 65. So it kind of looks like that, IEP initial enrollment period, but it's an additional 3 months. So 6 months prior to your Part B effective date, you can choose a Medigap plan or Medicare supplement plan. It's a kind of interchangeable word, Medigap, Medicare supplement plan during that time period and be guaranteed issue into that program. So it's very important. So if you're 64 and a half, you could start looking at your Medigap. If you're 64 and 9 months, then you could start looking at your Medicare Advantage program.
Yeah, and just
And then,
before we move
sorry,
on.
Nicole, please.
Oh, yeah. Did you want to go first? And then,
I was just going to confirm for those listening. So the secondary would be the part C and D. So that's what we're going over right now, correct?
Well, and the Medicare supplement.
Okay.
And the Medicare supplement. Yes.
correct. And what's really important to remember here is when in doubt, you're not expected to remember all of this. We're here to help walk you through that. But it's great to remember, just like you have an annual checkup with your doctor, remember that you can evaluate your plan every year during the time frame. It's the fall, right? Fall going into the holidays. And if we have caregivers here that are helping these individuals on these plans, it's really great to start getting in that mindset to do a hygiene check, basically, but with the insurance program for that secondary insurance. So setting up a phone call, setting up an appointment, really evaluating and comparing where the person you're caregiving for or where you're at physically and with your health.
Yeah, where you mentioned, it's the fall and it's like your entire career open enrollment for your health and
Mhm.
benefits through your job was always, right around November, October, whatever it might be. So it's just continuing that into retirement and into being 65 and over and everything. So it should be already on everyone's mind every year around that time.
Yes.
Exactly, because as we age, hopefully we're aging younger, people are staying alive, there's longevity, but sometimes ailments do come up, and a certain particular ailment could actually have you qualify for a special program as well.
Yeah.
Yeah. And even for the caregivers and everything, the adult children, um, it's their open enrollment period as well. So they can think about their parents and everything if that tends to be their situation.
Yeah. Absolutely. Common special election periods. So we talked a little bit about this, the loss of coverage or termination of coverage, uh, like from your employer-sponsored program. Uh, Also, if your Medicare Advantage program is no longer available in that county, you'll get a letter called through the annual notice of change that that program is no longer available and you should pick another program. If you're relocating, very important, that you speak to an agent as soon as possible. So, he or she knows when and where you'll be relocating to. And if you're already there, it's okay. We can speak with an agent, especially within those 2 months that you landed, so we could pick a plan in your area that's most appropriate. So there's different plans out there as well that we'll be talking about, but there's plans that are for chronic needs, diabetes, hypertension that are wrapped around the Medicare Advantage profile as well.
Awesome.
So steps to enroll in Medicare Part A and B through Social Security. So number one, will I be auto-enrolled? Do I need to enroll online? So, to determine your needs, generally you'll be auto-enrolled in Part A, and they'll send you a letter to elect to be enrolled in Part B. And you'll receive your Medicare ID in the mail. So it's very good to engage in Social Security as you approach 65 because we've moved throughout our life and we don't want your card to go to your old address. We want to make sure that your information is updated. So it's always a good practice to engage with Social Security as you approach your 65th birthday.
And we talked a lot about different enrollment periods and special election periods, but what are some of the most common enrollment mistakes you've seen?
Yeah, I think really not engaging with Social Security and you don't have the most updated address on file. I think that's number one. Um, One is saying, hey, I'm not taking any prescription drug programs, so I'm not going to pick one. If you don't pick one, there's a penalty for every year that every month that you don't have it. So if you do, need a prescription, 10 years from now, and it could be very costly, you then not only that you have to pay for the prescription drug program, but you have to pick up a penalty for all the years that you didn't have it. So
Hmm.
sometimes the strategy there is maybe pick the most inexpensive prescription drug program to avoid the penalty. So that's kind of a big one that keeps on coming up. So there's a number of one. I just need a original Medicare. I'm healthy, but anything could happen. An accident could happen,
Hmm.
and we've heard about a lot of them. So it's best to engage and find a program that suits your needs when you're on uh, on Medicare. Yeah.
I think the other one is that uh, most people just stay on an employer group program. They think
Oh,
it's,
yeah.
yeah, that's a big one,
Yeah.
Pete. You
That's a
want to
big
talk
one. So yeah, we've been working with a group recently, and it's interesting, this employer-sponsored group, because you think, hey, this is my employer. They've taken care of my health program for the past 30 years. Well, now they have this retiree program or something like this. We've seen premiums $1,600 a month on that program, and very similar program they could have got in their county for zero. So it's really important to review your plan when you turn 65, especially the individual plans on the market, even if you have access to your group sponsored program when you're Medicare eligible. And we've been seeing this um, out there in our in the environment, and we're here to help because we've come across some really high premiums from group sponsored programs post retirement. So
Yeah, it's very confusing. I mean, and somebody like my mom up until recently, she was on my father's retiree group program. She didn't realize how much she can save. And, that could be like property taxes year, or it could mean a vacation. There's a lot of savings that
Hmm.
come in that.
yeah, that's a great point,
Absolutely.
Nicole. Thank you. Yeah.
Well, thank you, Pete and Nicole, for walking us through the Medicare enrollment and the different coverage options available. Before we move into discussing more about my senior health plan and getting into the Q&A, I just wanted to spend a couple of minutes talking over how Medicare works alongside senior living. So, one of the biggest misconceptions we hear from older adults and their families is that Medicare will cover the cost of moving into a senior living community. While Medicare can absolutely play an important role in your healthcare, it's helpful to understand where the coverage begins and where it ends. So, what Medicare may cover? Medicare is designed to cover healthcare services, not housing. So, depending on your situation, Medicare may cover things like, as Pete and Nicole already mentioned, the short-term skilled nursing care or rehabilitation following a qualifying hospital stay, physician visits and outpatient medical services, hospital care, preventative services, and depending on your plan, prescription drug coverage. So, these are all medical benefits that can continue whether you're living at home or living or residing in a senior living community. What Medicare does not cover is Medicare generally does not cover the monthly living expenses associated with senior living. So that includes monthly rent and services within independent living, assisted living, and memory care communities. It also typically doesn't cover what's known as custodial care, which includes assistance with everyday activities like bathing, dressing, eating, stuff like that. Medicare is health insurance, but it isn't long-term housing or long-term custodial care insurance. So understanding that distinction early can help families plan more confidently and avoid surprises later. Because everyone's situation is different, it is important to plan ahead. As we've been saying, this entire time, it's very important to plan ahead. And some people may pay for senior living through private funds, long-term care insurance, veterans benefits, or other financial resources. And just as, Pete and Nicole did mention earlier, it's also a good idea to review your Medicare coverage annually and make sure it continues to meet your healthcare needs. You can also talk with a trusted advisor like My Senior Health Plan to better understand your options. And speaking of talking to a trusted advisor, or for all of our listeners today who have never worked with a Medicare advisor before, what can they expect to hear during this first conversation?
Yes. First of all, we have incredible advisors on the phone that really take the time. So we're very proud of them. And they go over an initial assessment. We start by asking them about their current Medicare status. We want to talk about their coverage, where they live and what's important to them. We move through and ask them about the prescription drug program and what doctors and prescriptions they're taking, what matters to them most through their coordination of care presently. And then the recommendation, we suggest a plan that is best suited, that fits all of that criteria, which is really important. So that's the difference between being a consultant, being a salesperson. When you're speaking to our organization, we are consultants. We want to make sure that the plan meets your needs. If you call any of these companies directly, they're only allowed to talk about one plan, and they're there to sell that plan. That's what their function is. We are there to represent our clients and find the most appropriate plan for them. So it's the personalized overview where we provide the tailor overview of all the Medicare options that's available to them. So we're very, very proud of our position. And the support doesn't stop there. It's the post-enrollment support. We have a whole uh, customer service team to make sure these plans are always working for our clients. So for any reason they're not um, these plans are not meeting their needs, or they feel like they need some direction, we always would like them to call our office and we'll help them sort it out. It could be just a simple question, or we have team members that really get involved and call, that insurance company and see if we could get the ball moving on their behalf.
And one thing I'd like, Pete, that you can speak of is, there is no cost for our help. We don't want people to get that confused with no cost for premiums, right? Some premiums may have no cost, but then, I'm sorry, no, some plans may have no cost. The thing that differs here is important to know is that how that works, right? How that is regulated by CMS.
Yeah. So we get compensated through these health plans, and it's all regulated by CMS. So it doesn't matter. They all pay us the same. It's very transparent, and we love our position so that we could always provide, the unbiased, opinion of these plans. And like I said, many times we say, you're on the most appropriate plan. If anything changes, let us know. And we get a lot of referrals. And you could look at our Google reviews. We're very proud of them. In the past, we used to receive handwritten letters, and it was just super sweet. And we would talk about those during our monthly meetings. Now we have something called a Google review, and people have been online just talking about some of the things that we've been doing.
Yes, and
Just
just to
about, go
back
ahead.
up, one moment is CMS. Some people may not understand that's an acronym for the Centers for Medicare and Medicaid Services, which is highly regulated.
Yes. Just a little bit more about My Senior Health Plan. We've been a trusted resource for the past 20 years. We have offices in San Diego and Nashville, Tennessee, to really cover the nation. We are proud about our position, independent and unbiased support. We're here to make it simple, but we still want to make sure you're well educated on your program, and ongoing support. I think that's the big thing. We've invested heavily into our ongoing support, so that way, year over year, you're well supported. These needs change, your needs change, and these plans change every year. But we're here to help you.
And I think we have a short video that goes a little bit more into
I'm Pete Blassie, President and CEO of MySeniorHealthPlan.com. For over 20 years, we've been a trusted source of unbiased advice for the Medicare eligible community. Our experienced, professional, and licensed staff are dedicated to helping you navigate the process of finding the right Medicare insurance plan. Our service is offered at no additional cost, and we are licensed nationwide. Book an appointment with us today by visiting MySeniorHealthPlan.com or call us toll-free at 877-255-6273. We're here to serve you.
So I will open it up to any questions. We did receive one in the meantime, and I can take this. Is it possible to share this presentation recording with a family member, or will this be conducted again? So yes, this is being recorded and will be hosted on Grace Management's YouTube, and we will also send it out on social media as well. And then I think there's another webinar that My Senior Health Plan is coming up that we do have information on in the slide deck as well that you can join, which I think will give you a lot more information. And then Pete and Nicole, you can mention if that is recorded and where that will be hosted afterwards.
Great. So, do you want to go through the questions first, or do you want me to talk about then what's next?
Yeah, we can give a moment and see if we have any other questions come through. Oh, we just had another one. I'm turning 65, but still working. Do I need to enroll in Medicare right away?
Well, that depends. If how big your group is. If it's under 20 that you're on, you Medicare would be primary, and then your group would be secondary. If you're coming from a large group, Medicare is secondary, and then your group is primary. So, and if you're on the group, you may not need Medicare Part B if your group is primary. So sorry for the long answer to that, but it has to do with how large your group is. And then in looking at your group, you still want to speak to probably one of our professionals, because looking at is your group fully subsidized? Is it, if not, what's the premium that you're paying? Is there a high deductible to it? And does Medicare make sense, right? So it's a bit of analysis, but we're here to walk you through it, and to see if you should uh, make Medicare primary or secondary, or move off the group or not. So there's a lot of things to consider, but we're here to help.
Awesome. And I know we're getting close to the top of the hour, so I'm going to move on. But if any other questions come through that we don't get to, we will absolutely follow up with you via email.
Nicole, you want to introduce the slide?
Yes, we have monthly educational webinars and seminars. So if you know of anyone in the San Diego area, we do have an event space where we welcome individuals that are new to Medicare and their families, caregivers. You can reach out and learn more. But most importantly here, we know many people may not be in San Diego. So we have national monthly webinars where we cover the ins and outs of Medicare and what you need to know and how to get started, so we can answer all of your questions. There's a live Q&A with one of our senior Medicare agents on the actual presentation, walks you through. It's a little bit more in depth than what we did here. And our next one is on August 20th at 10 a.m. Pacific time. You can scan that code and or call us, and one of our team members will help you get registered.
Yes.
Awesome. I'm sure it'll be a great webinar. And thank you so much again, Pete and Nicole, for sharing your expertise today. And thank you to everyone who joined us. At Grace Management, one of our goals through the Grace Presents series is to bring together trusted experts, such as Pete and Nicole, to help simplify topics that matter most to older adults and their families. We hope today's conversation has helped make Medicare feel a little less intimidating and given you all the confidence you need to take your next steps. If you'd like to learn more about My Senior Health Plan or connect with Pete and Nicole's team, simply scan the QR code on the left-hand side of your screen or follow My Senior Health Plan on social media. If you'd like to learn more about Grace Management, our communities, and the resources we offer, you can scan the Grace Management QR code on the right side of your screen or follow us on social media as well. Before we wrap up, we are excited to share that we're already working on our next Grace Presents webinar. We're putting the finishing touches on the details, but we think it's going to be one you won't want to miss. To be among the first to know when registration opens, we encourage you to scan the newsletter QR code at the bottom of your screen to sign up for the Grace Management newsletter. It's the best way to stay up to date on upcoming webinars, educational resources, and the latest news from Grace. Thank you again for spending part of your day with us. We truly appreciate your time, and we hope you'll join us again for our next Grace Presents webinar. Have a wonderful afternoon, everyone.
Thank you so much.
You guys.
Thank you.